Thank you, Liz, for the lovely presentation, introduction, and if we can have the presentation up. I'm going to talk about the impact on the labor force, as Liz said. If you go to the next slide, please. We do have quite a bit of evidence on using observed data. So that's one of the buzzwords for the presentation and the session, observed data, and also empowerment. If you can go to the next slide. Oh, no. I'm sorry. Oh, here we go. So the global force, the global labor force in a changing climate. ILO estimates that about 2.4 billion out of the 3.4 billion workers experience excessive heat at work. This number is plausible. The second bullet are not. They only estimate about 23 million occupational injuries per year and 19,000 deaths. These numbers are a very low estimate. One example, about 6,000 Qatar World Cup workers died building those beautiful stadiums for the football we all enjoyed, right? Only one of those deaths mentioned heat stress as a possible cause, right? So we know that these numbers are very underestimated. Climate change is affecting the human right to safe and healthy working conditions. We have established that, but let's get into the details. This is from the UK. We have used data from here, UK labor force, and estimated thresholds. There's going to be a lot of talk and already a lot of discussion, very good points about how do we estimate thresholds? Can thresholds be estimated? We have shown we can. So this is only for the outdoor sectors. And we've also estimated how moving away from these thresholds have affected labor supply in very high spatial resolution in the UK. As you can see, south of the country are heavily affected. And more importantly, here, if you see here, these impacts have increased over time. We have similar evidence from Europe. This is from the Lancet Countdown in Europe report, which Liz and I laid the indicator for. And as you can see, over time, in Europe as a whole as well, the impact of heat stress on the labor force has increased, right? And it keeps increasing. Back to the UK. Having said all this, there's still very little rigorous quantitative information how heat stress affects worker health and the extent to which they're able to adapt, right? We also know very little about the effectiveness of interventions, such as early warning systems, rest breaks, and so on. The second key word is empowerment. We're going to look at how empowerment of workers, their ability to make decisions on adaptation or taking adaptation actions, affect their health, affect their labor supply, affect their labor productivity. Unlike most models in this study, we explicitly control for adaptation. And this is something Liz mentioned already. Additionally, we explore the specific challenges that workers face during periods of heat and barriers and constraints to adaptation. Last year, we collected ephemeral data on 2,000 workers in the UK. Although the UK did not face a heat wave like you were doing this year, temperatures at the end of July did go up to more than 30 degrees, in fact 32 degrees in Kew in London. And as you can see in these maps, over time, over the last 2 weeks of July 2024, mean temperature increased every single day, right? On the left-hand side, you see red lines that show the warmest 5 years on the record. And again, the trajectory is awful, right? It's warming, and you're having more and more hot years, every year almost, it seems. So 2,000 workers in the UK labor force using Qualtrics. This, to our knowledge, is the only known source of data on adaptation and adaptive capacity in the workforce. The point of this slide is to show that our survey closely reflects that of the UK labor force. So we are very confident in how our data is nationally representative or representative of the UK workforce as a whole. We showed that nearly 3/4 of the workforce worked in areas where temperature anomaly was 0.5 degree above the long-term average. Nearly more than 8% of these workers were working in conditions where the temperature anomaly was greater than 1 degree. So the exposure to high temperatures was very high in some parts of the country. Less than half the workforce had access to air conditioning. As you'll see later on in the results, Liz already mentioned the central line. Our analysis showed that workers that had to take public transport to work, they had 10% percentage point more chances to suffer from occupational health-related hazards. We have quite a bit of evidence on how it harmed their health. Workers undertook a wide variety of measures to save or to protect themselves from high heat or to adapt to high heat, whether starting work early, that is shift changes, working fewer hours. 13% workers took more breaks. Nearly 1/3 of workers reported drinking more fluid than usual. Some people changed how they got to work, right? But the issue here is that many workers, if not most, do not have the ability to change how they go to work, right? And a double whammy is that many more workers are likely to drive to work when it gets that hot. Employers' reaction. We found that almost 20% of those employed, they said that their employers had changed or made some changes. And this was mostly due to the 2022 heat waves, whether they're providing more rest breaks, more water breaks, and so on. Heat alerts. This is quite possibly one of the key, most important findings from our work. More than 24% received heat alerts from employers, but 40% received heat alerts from either the Met Office or another public institution. More than 1/3 received heat alerts from the media, and mostly the BBC. So again, yay for public institutions. We asked workers about their health, but also number of hours they worked, the effort they put in, and then we, according to us, used robust econometric techniques to understand the determination, or what determines their labor supply and their productivity. I'm not going into these details of here. One of the most important findings, again, key, adaptation works. Workers who were empowered to adapt or able to adapt, such as changing shifts or changing from where they worked, did not have to reduce their working hours as much as who could not adapt, right? So this is a win-win. For employers who made changes to the workplace in the form of either rest breaks or water breaks, their employees were also less likely to reduce their working hours, right? So just by making some basic changes, you protect your workforce, you protect their health, but they're able to work more or they're able to work the same amount of time, right? Workers in high exposure sectors such as construction, obviously, as you would think, had a higher chance of reducing their working hours. Contract type matters. Workers on hourly wages or those who work on commissions were less likely to adapt, and this showed up over and over again. Heat alerts are very effective. Heat alerts lowered the probability of workers having to reduce their labor supply or their productivity, both their hours worked or their effort. But it also reduced workers suffering from health conditions or heat-related health symptoms at work. If we want numbers, a 1 degree positive temperature anomaly, or working in conditions where the temperature anomaly was higher than 1 degree, workers reduced the hours they could work by nearly 10%, and their productivity was reduced by, again, nearly 10%. However, those who received alerts, they only reduced these two outcomes by about 4%. Back to numbers again. A 1 degree temperature anomaly resulted in more than 100 million hours or working hours lost in the UK. This is a very high number. Health. Again, strong evidence that those who were empowered to adapt or could make changes suffered less health-related conditions at work. Advanced warning helped, especially for those who worked either in physically demanding jobs or in high exposure conditions. Older and younger workers, they suffered relatively more. Being able to change shifts or working locations reduced the probability of workers or of a worker reporting negative health impacts by more than 3.5%. So, again, for occupational health, adaptation, simple adaptation measures are very effective. Now going from local in the UK to what can we do globally. This is attribution. It's a buzzword for climate litigation and loss and damage. This again, joint work with Liz and a bunch of other colleagues. Here we are able to show clear, measurable impact of climate change on the labor force. So this is what has already happened. It's only results for the high exposure sectors. Globally, without climate change, compared to what would have happened without climate change, the labor supply is more than 3 percentage points lower during the last 20 years, right? So we are comparing observed climate to a no climate change scenario, essentially. Very high effects in the last 20 years or so. And the highest effects are in areas such as Southeastern Asia, Middle Africa, so already low-income regions. We're also able to translate these labor force damages into GDP impacts. Up to 19% of GDP loss has occurred in just 1 year due to climate change-induced impact on the labor force, right? This is under review in Nature Climate Change. This is a starting point of estimation of loss and damages, and of course for climate litigation. This is at the global level. So just to show what we can do at the local level with ephemeral data, but also with observed data from more than 130 countries. To end, our next steps, and we're already doing some of this, we are engaging with key stakeholders such as trade unions, we'll hear from some of them today, but also importantly, UK HSE. We do have representatives from the UK HSE here. Our goal is to provide evidence for regulations to protect the workforce. We would like to keep collecting this data after periods of high heat to understand how over time workers are affected, but most importantly, test efficacy of adaptation strategies over time and track both the short and long-term impacts on the workforce. We would like to have a dedicated survey on gig workers, although it's a very small number now. In the next 10 years, the gig economy in the UK is expected to reach 7 million workers. That is a very high number again. As Liz said, gig economy workers are particularly vulnerable, not just for their health, but also their livelihood, because they simply, again, are not empowered to make adaptation decisions. With that, thank you very much.
So I'm thinking the good news here is that we're already, it sounds weird, we're already in a suboptimal situation most likely, that with sensible adaptation, we could improve health, improve productivity, and that productivity improvement would probably cover the costs of the adaptations. And so it's crazy that we're suboptimally adapted, so things could improve. We do have time, if there's any questions, for a question for Shouro, if anyone's got one formulated, otherwise there'll be time afterwards. Oh, we have a question. Oh, you need a mic, sorry.
Hi, thank you, Pedro from the Hull York Medical School. I was wondering if you have any, done any research around the impact of interventions, for example, climate literacy or education on workers, or if you're aware of any research around that and what the impact that would be on workers and labor and productivity?
So not directly, that whether we haven't tested impact of, let's say, education or information, but in our survey, we do ask workers where they found their information from. And workers who had prior information, who knew about either alerts or upcoming heat waves, they were more likely to both adapt and as a result suffered less. So indirectly, yes, but not directly yet. But that's a very good point.